My name's Dr. Alexander Kawimbe. An obstetrician gynecologist in Kawe, working at Kawe Women, Newborn and Children's Hospital, as well as Kawe Central Hospital. I was trained under Merck Foundation way back in 2019, a course regarding fertility treatment called Advanced Reproductive Techniques. That was in India, from Indira IVF Fertility Hospital. And that was a 3-month course and was completed that very year. And I've been practicing what is practicable locally from the training that I did. So the training at Indira IVF was quite intensive, taking both theory and practical sessions. And it was quite hands-on, I think, from start to finish, running through different sections of the treatment cycle and different rotations. We had a skills lab that was quite handy in having some hands-on practice before we could touch patients. And then we also had advanced kind of orientation on ultrasonography for obstetric care and as well as fertility treatment. Then we had lab sessions, both in the skills lab as well as the andrology lab, where we learned how to handle specimen regarding reproductive health. And every day, almost every day, there was always one of our trainers who would take us through real life case presentations and discussions and different kinds of cases and how to go about managing those different conditions. So after the training, when I came back here, obviously the biggest challenge was that the setup here and the equipment, as well as facilities available, especially in Kawe, were a little bit off from doing the optimum. But there was quite a lot of knowledge and skills that we picked, which is applicable here. For example, ultrasonography and saline sonohysterogram, which we can do in place of HSGs, which we routinely do. And that has been very much applicable, and for the patients who can afford to access services, for example, laboratory services which are not available locally, but they can access them from nearby towns like Lusaka or the Copperbelt, we're able to do a bit more for those patients. And I think from the various treatment regimes we had for basic advanced reproductive technologies or techniques, some of the patients lately, I think the results from their treatment has been a bit more impressive than was before the training. And to just keep up with the knowledge and also the skills, the main thing that I do is to share with students as well as other doctors in the training that we had and what it is we can do to apply locally that can help the patients. So with the training in ART or Advanced Reproductive Techniques, I think the patient assessment that currently I do than I used to do before is a bit more focused and very patient-oriented or couple-oriented. And the benefits for some have been having, for example, a successful pregnancy with regards to the different treatment regimes you can apply. And in terms of knowledge and skills, obviously my skills regarding patient assessment and tailoring the kind of treatment that you require for a particular couple and their problem has been changed quite tremendously. And also there has been some patients who have come back with, of course, gratitudes once they have successfully achieve the pregnancy and the baby. Long-term plans, main one is actually to lobby that Ministry of Health or government does go through with the proposal and the plans to open a fertility treatment facility that can be accessible to our Zambian clients and patients who cannot afford the higher costs of services from private facilities. The training does open up your mind and open up your other skills, which may be limited by the environment where you are. But once experiencing that kind of training, experiencing that kind of service being offered elsewhere, in many ways you can still apply that same knowledge and skill locally to change one or two things that's going on at the moment. Thank you so much, Merck Foundation, for supporting my training.